First Responder 101, Part 2. You're watching The Art of Prepping. Hello, my friends. Thanks again for coming back to this video. This is a remake. I had a small mistake toward the end. Not so small, in fact. It was saying that you should use aspirin if you're thinking you're having a stroke. I misspoke on that. Actually, I know you shouldn't do that. I kind of meant to say something different. It came out wrong, so I apologize. Once again, do not take aspirin if you feel like you're having a stroke. So let's go ahead and go into this for those who haven't seen the first take of this video. And so basically we identified in part one, sizing up the scene, going through the ABCs, and we're looking at now making sure you have the gear you need, first aid and trauma gear, which hopefully you can keep some of this in your vehicle and in your home in case you need it. Of course, we're talking about just you and me, us normal, regular people that are not, doing, medical things as a profession. We're not EMTs, paramedics, nurses, and doctors. So it's good to know some of these things I'm going to highlight as some of your core skills to be a good first responder. First one is going to be hemorrhage control. It could be something as simple as a nosebleed or a massive arterial bleeding. And so you may have to get out the tourniquet or compression bandages. It's good to know CPR. Take a class from the American Heart Association. They're not doing so much rescue breathing at this time. They're not pushing that, but they are pushing circulation through compressions. Because after about 4 minutes, brain death starts to occur in most people. You should definitely know how to do the Heimlich maneuver. How to operate the automatic external defibrillator, also known as an AED, how to treat shock, how to deal with hypothermia, how to deal with strokes. You can do a simple test. You can ask the individual to smile and to see how symmetrical on each side the smile is. If you have droopiness on the face on one side and not on the other, then you might have a major problem. Once again, do not give aspirin to those who you believe are having a stroke. Also, another an interesting fact here would be that some people are pregnant, and sometimes birth doesn't wait until you get to the hospital. So childbirth is something that's actually a skill. I learned it, many years ago, just in case. And so I'm sure there's probably new techniques now that weren't out 10, 15 years ago. So I am actually going to be actively pursuing that skill to make sure I'm up on the latest. And so that's just kind of a good outline there. Of course, when we talk about also first aid, how to make a sling, how to bandage areas, how to make splints. There's a whole other medley things, for eye injuries, mouth injuries. Lots of those kind of things you definitely would want to learn in more basic first aid. But don't forget the trauma elements as well. And if you have any questions, I am not in the medical profession, but I have taken a lot of classes over the years just because of various college electives and or where I worked in the past required various levels of training. And so maybe I could be of some help. There are people on the channel that are much more knowledgeable, and thank you for chiming in. So maybe we can all learn together. Thank you for your support. Thanks for all of the interaction, and I will catch you all later.